A whistleblower from a HWO reference labs in Hong Kong is alleging a COVID-19 cover-up in exclusive Fox interview, and I'm sharing this video for letting people to know.
I'm Dr. Li Meng Yan. You can call me Scarlett. I'm from Hong Kong, and I work in the University of Hong Kong School of Public Health. My lab is the top lab in the world for coronavirus. The reason I came to US is because I delivered the message of the truth of COVID-19.
Dr. Li said that she tried to speak up overseas and was forced to leave her friends and family behind.
If I tell it in Hong Kong, the moment I start to tell it, I will be disappeared and killed. No one can hear me. So for this purpose, I would like to go to US and tell the truth of the origins of COVID-19 to the world, to let people understand how terrible, how dangerous it is. This is nothing about politics. This is a thing about whether all the human in the world can survive.
Her early research into the virus was allegedly covered up and could have helped to fight the spread of COVID-19.
I'm the one of the first one get involved to COVID-19 research in the world from end of December. Since the 31 December, once we know there is a SARS-like coronavirus in China, in Wuhan, my supervisor, WHO consultant, Dr. Liu Peng, asked me to do some secret investigation of what really happened in mainland China. The China government refused to get overseas experts, even include Hong Kong ones, to do research in China. So I turned to my friends to get more information. This is a conversation happened on 31 December. I talked to a friend who is a scientist in the CDC in China. That friend has a first-hand information. And this person told me there is family cluster cases, so there should be human-to-human transmission.
But as you know, HWO didn't say anything about infection between human to human for many weeks. Even they praised what China did. Also, they delayed the pandemic, even though all the people knew that we were already in the pandemic. This is the picture I took from HWO, and they announced this article on last January 9. As you can see, they say that the virus in question can cause severe illness in some patients and does not transmit readily between people. And this is the tweet of HWO. 5 days later, they say that no clear evidence of human-to-human transmission of novel coronavirus in Wuhan, China. And the doctors who were willing to share the information with Dr. Li were extremely scared to speak about COVID-19.
So this is a group full of the clinical doctors in a different hospital all over China. This is from the 31 December in China. And early morning, one of the doctors asked whether there are doctors in Wuhan who can share this information about this SARS-like virus. But there are people immediately warn this doctor that don't ask. And this is too sensitive. We cannot talk about it, but we need to wear masks.
On January 16, she said that she was asked to reach out her China contacts again, since the government was providing few details.
First, the human-to-human transmission become very worse in Wuhan. There are many patients that don't get treatment on time and diagnosis on time. There is no protection for both doctors and the patient and common people. And also, the government doesn't allow people to release such information. Hospital doctors are scared, but they cannot talk. CDC staffs are scared.
This is when the cover-up of her research began. She said that.
So I report these things to Liu Peng once I get the result, but he asked me to keep silent and be careful, as he warned me before, don't touch the red line. That means don't go across the China government's procedure. Don't cross the China government principle. If not, we will get in trouble, will be disappeared. I thought this information could be delivered to public. And it is a very urgent information, so it should be responded to the public as soon as possible. But then he didn't do anything because I didn't see any response after many days even. and also our co-director of the WHO lab, the Prof. Malik Paris. And they know it, but they didn't do any action. As a virologist, and even some of them are doctors, they should know how terrible this is. This is a public health threat. They should do the quick response to it. They should have done many things. There are so many choices they can do to control this outbreak, not let it spread as the biggest disaster we have seen in the human history.
When it appeared to her that her boss, Dr. Poon, and the co-director of the WHO reference lab, Dr. Paris, had failed to pass along her findings,
I feel very disappointed, but I already know this would happen because I know the corruption among this kind of international organization like WHO, to China government, to China Communist Party government. So basically, I accept it, but I don't want this misleading information to spread to the world. I think it has to be corrected. I know what will happen to me. I know how they treat the whistleblowers. I see how terrible the government suppressed those young, innocent protesters.
The WHO denied Dr. Lee's claims and told folks many people do work for us as consultants. But again, this does not make Dr. Lee, Dr. Paris, and Dr. Poon staff members, and once again, they do not represent WHO. Fox News was unable to reach the doctors for comments. The spokesperson for China's embassy told Fox that they had never heard of Dr. Lee and that the Chinese government has responded swiftly and effectively to COVID-19 since its outbreak. Despite the risks, she started leaking to US-based blogger who published her finding on January 19, but only to Chinese.
Unfortunately, Chinese-speaking and English-speaking are totally isolated. So we get response from our government within 4 hours report this. The government changed the case numbers from 62 to 198, triple. They admit this is human-to-human transmission. And also, Chairman Xi issued the first statement in 2020 that claimed this one, new coronavirus, actually is infectious disease, which put to the same level as SARS at that time. And then later, within 3 days, to 23rd January, they locked down Wuhan.
A week later, she received a dire warning from the blogger.
He knows that I'm in danger. I have to leave as soon as possible. And asked me that whether I want to go to US to tell the truth to the world. I said I'm willing to do that, and my husband found that phone call.
Her husband worked in the same labs. She said that he knew about her research, was close to Dr. Paris, and supported her research in private. But when she asked him to come with her and explained what was happening,
he's totally pissed off, and he blamed me, tried to ruin my confidence. Also show he's totally scared of China government. He said they will kill all of us. I tried to persuade him to go to US with me, but I failed. So Monday, 27 April, I got my US ticket. And then 28 April, I took the flight to go to US.
With the help of the political exile group, she left the country without raising any alarms.
That day, I was very nervous. Any step before the flight set off, I know I can be stopped. When I arrived at LAX, initially it goes very well. I passed the custom, and then I get my luggages. When I tried to go through the exit, there were 2 officers stop me. Seems they are waiting for me. I don't know why. They just stop me and bring me to the office, and then try to ask me where I'm from, what kind of work I'm working on. And I'm so scared. So I think I have to tell them the truth, because I don't want to come here to do anything wrong. I'm doing the right thing. So I tell them that don't let me go back to China. I'm the one who come here to tell the truth of COVID-19, and please protect me. If not, the China government will kill me. And those officers are shocked.
She says the FBI interviewed her for hours, took her phone for evidence, and allowed her to continue traveling in US. But a very different scene was unfolding back in Hong Kong.
Since I left Hong Kong within just several hours, when I was still on the flight, the whole government recruited and the China Ministry of State Security went to my hometown Qingdao and with policemen to give trouble to my family.
Suddenly, she lost access to her work accounts and email, even though she says she was on approved annual leave at the time. Then the cyber attacks began on her.
Since middle of May, our government started to put online the attack on me, like the cyber military attacking me from Twitter. At that time, I didn't expose my identity. I haven't been to the public. Only they know who I am. They try to spread a lot of rumor, ruin my reputation, and said I'm lying. They create a fake Facebook account, which is under my Chinese name Yin Limeng, using my profile, and to tell people that I'm kidnapped in US. I try to lie to people, and even I have the mental disorder. Also, the University of Hong Kong blocked my staff account and tried to delete my webpage from the University of Hong Kong website. All the things like this, I'm sure once this go to the public, there will be worse things come to attack me, full of lies.
The University of Hong Kong told Fox News that Dr. Li is no longer a staff member, but would not comment on when or why she was terminated. Now she believes everyone she knew is likely in danger.
Of course, I'm afraid of the safety. I'm worried about the safety of my family and my friends and all the people who had sent me the information. No matter doctors or officers or lab people, researchers, scientists, they all know it clearly. They trust me. And so that's why I need to protect them. They are all under surveillance, under trouble, and my family in life-threatening danger definitely every day.
She believes that her own life is in danger too, but she says time is running out for the world to do what's right.
Social distance. 2 meters is better. 70% alcohol is very useful, clean your hand. And also wear the mask if you get close to people. Surgical mask. This is about global health. No political issues. I mean, this is all of us involved. No matter this party, this country, that country. The only thing is, when people understand the truth, they know how to protect themselves. You have to imagine how many cases not reported from China. Already, if there is 6 million people in the world, 1 in 600 get confirmed. But this will increase in a very quick speed. Imagine one day you see 1 in 100 people already get infected in the world, and later 1 in 50, 1 in 10. That means none of us can escape from this. Don't expect the herd immunity, especially at this time, because you don't know this virus. You cannot judge the character of this virus according to our previous experience. And we don't expect the vaccine at this moment or some magic solution at this moment. The only thing we can do is to understand where it comes from, do the right research, and protect us, protect our family, our friend, anyone around us in the right way. That is the only thing we can do now. That is why I need to tell it to the world. I really need people to understand this is very, very critical for every one of us.